Confessions. It is Wednesday, August 17th, and my name is Leslie Bolus. This is Leslie's Cancer Confessions. You will see me referring to this little notebook to keep me on track. This is the second part of a three-part series on different aspects of cancer. Last week I discussed being diagnosed with metastatic breast cancer and the different things that will happen, that you will go through as you are living through that diagnosis process. This week I want to talk to you about actually living with metastatic breast cancer. If you've watched this video for any length of time, you'll know that I have lived with metastatic breast cancer for the past 5 years. And if you are watching this video, then you've watched the clip of the intro, which covers things that I've gone through, that I've lived with, that I've enjoyed over the past 5 years. Trips, birthdays, anniversaries, graduations, my daughter getting her first degree, my son getting engaged, moving 5 times, so many different things, and they're all included. It could not include every single memory, every single moment, or it would have been weeks and weeks long. But I wanted to give you the idea that living with metastatic breast cancer is very similar to just living your life, except for you have a few little roadblocks and obstacles and things that you now need to squeeze in. For instance, you will, now that you have gone through the process of being diagnosed and having all of your blood work and labs and testing done to determine what type of metastatic breast cancer, i.e. Inflammatory, triple negative, estrogen receptor positive, at this point, you are now beginning your new life with metastatic breast cancer. Those tests will help to determine what sort of chemotherapy or radiation and nausea medication you will be on for the next little while. I started out with intravenous chemotherapy of Taxol and Avastin. Now, you may either receive this in your arm as an IV, or you may surgically have a Metaport put in, which will allow you to have not just your chemotherapies administered through this, but also your blood draws to be done through this. That will alleviate having to be poked repeatedly on your arm. Sometimes an IV doesn't work out and they have to poke several veins to get that to work. And then sometimes that vein becomes blown and they have to just keep going up and down your arm to find new spots. So I would recommend, and of course I'm not a doctor, but speaking as a patient, I would recommend that if your doctor recommends you get a port, that you consider his advice strongly or her advice strongly and do that. Get a port. I have had this one for 4 years, and previously I had a double lumen port, which was a power port, and I had had that for a year before I developed a little fiber sheath that had grown over the end and blocked it, so they had to remove it. But 4 years is a pretty good length to have a port, and it's been very effective and helpful. And even though I am now taking oral chemotherapy, I am very thankful that I have this because they do all of my blood draws. So now you know what type of cancer, metastatic breast cancer, you have, and your doctor and you have determined what sort of chemotherapy you are going to have. In addition to chemotherapy, you may have to have some radiation treatments. I received radiation on my right arm, below my elbow, and above my elbow because I had several tumors growing in my bones that were causing extreme pain. They used the radiation treatment to alleviate the pain by shrinking those tumors. That left behind little microfractures, which later, unbeknownst to me, would cause lymphedema in my arm. Was it worth it? Yeah. I would rather have a numb arm that is quite a bit larger than have lived through the pain that I was going through with the bone pain. Do I still have bone pain? Yes, but it's greatly diminished. So you may be recommended to have radiation in addition to your chemotherapy. Most patients start their chemotherapy treatments with a infusion type chemotherapy. You may reach a point in your chemotherapy where your chemo is no longer effective. Your cancer may be growing more in the sites where it already exists, or it may have spread to other sites. And at that point, your team will discuss with you going on to different chemotherapy drugs. In researching for this video, I discovered that there are well into the hundreds types of chemotherapy drugs that treat all different types of cancer, but there are only around the ballpark of 20 that they use to treat metastatic breast cancer. Generally, when they use a chemotherapy drug, that drug is what they call burned. So you cannot return to using that drug. What they're now doing with metastatic breast cancer is, instead of saying that a drug is burned, they say that they can no longer use it in combination. Stop. They can no longer use it in combination with the same drug that they used previously. Now, there are several types of chemotherapy treatments for cancer treatment. You may take estrogen if you are ER positive, or estrogen suppression with your chemo and your radiation and your... Oscar! No! With your chemo and your radiation and your hormone suppression. You will probably not receive just one type of drug for chemotherapy. There are several types of drugs. Some of them are specifically targeted to the type of hormone or searching for my words here. Type of cancer cell that you have. So that is called targeted therapy, and then regular chemotherapy that just kills all cells. So they give you a targeted therapy and a chemotherapy in conjunction with one another. Hence, I had Taxol and Avastin. Now I am on Ibrance. Previously, when my Taxol and Avastin was no longer effective, I took, it began with an X, and I cannot think of the name of it right now, Chemofog. But I only took that medication by itself with a hormone suppression drug. So when you are at a point where your IV infusions are no longer effective, they may change you to an oral medication, or you may continue taking your infusions. But my recommendation is, even if you reach a point where you are no longer receiving infusions, you should continue to keep your Metaport, because they can still draw blood from that. Okay. So I covered that. Targeted therapy and chemotherapy. Now, each week you will go to your doctor. Well, not each week. Whatever your treatment is, mine is 21 days on and 1 week off. So you may go during your week off of whatever medication you're on and have your labs drawn. and determine what your white blood cell count is, your red blood cell count is, your lymphocytes. Maybe your doctor will look at your potassium level, and depending on where those levels of all of those things are, the doctor may decide to not give you your next treatment, or may decide that it's a go and you can have your next one. So you will always, at least once a month, see your doctor, and you will have labs before your each chemo treatment to determine if you can have it. Now, don't be distraught if they tell you that you cannot receive your chemo. It doesn't mean that during that time your cancer is going to run rampant and that you are going to die. What it means is that your body couldn't handle having the chemotherapy at that point because of whatever is off, your white blood cells, your red blood cells. At that point, they may give you a shot to increase those cells and give your body a little bit of a rest from chemo. Look forward to those times if you have them, because it's a restorative period for your body. Something that I want to really reinforce with chemotherapy in general, no matter what type of cancer a person has, is that at the beginning, when you've first been diagnosed, especially if you have infusions, you will notice that you are the crowded part of the infusion room, that you may be the person that has your husband and your children and your mother or your father with you, and there's a crowd around your chair, and as you look around, you'll see that the other patients maybe have one person, or they're there by themselves. And the reason for that is that after your life living with cancer becomes routine, people go back to living life as normal. They don't miss work to come with you to your appointments. They don't miss school to come with you to your appointments. They go on as if life is normal, and it is. It's a new normal. You have cancer, and you're going to live with it for a very long time. The treatments that they have now, the way they administer them, it has kind of made living with metastatic breast cancer a chronic condition, something that you can live with for a long time. So that is hopeful, and that is good. Of course, the goal is that we want to have it cured so that we don't have to endure all these treatments and medications and tests. But the good news is that it used to be a death sentence, and now you can have many years and many memories and a lot of positive, really good things, because the medication makes that possible now. There is also a time in your chemo treatment where you may have been going for months and months and months, or even years, and your doctor says you've had a PET scan, which you will probably have every 3 months or 6 months, depending on your insurance and your oncologist, how aggressive they are with staying on top of your cancer spread. You will have a PET scan, possibly a CT scan, because I have it in my lungs. I get periodic chest x-rays. If you have brain cancer or spinal cancer, you may have to have an MRI. Those happen periodically. I'm just using 3 months as a road mark because that's how they do them for me. This month I'm having a CT scan. About every 6 months I have a PET scan, but every 3 months I'm having one form of scan or another. Those tests will tell the doctors and you whether or not your cancer is under control, just staying the same, which means the chemo is working because it's not spreading, or whether the chemo has stopped working and it has grown in the sites it's already in or spread. And at that point, you will perhaps hear this term, NED or NED, Or they may say you're dancing with Ned, which means you have no evidence of disease. This does not mean you are cured. This possibly means that you may be given a chemo break. Usually they're short. They are perhaps 6 weeks to 8 weeks long, but you will always be on chemo for the rest of your life. Taking chemo is what keeps your cancer from reoccurring or spreading to other sites. So if you are given the blessing of having a chemo break, enjoy that time. Your doctor and you may determine that a chemo break is not the correct thing for you. I have had 2 chemo breaks in the 5 years that I've had cancer, and or I should say that I've been living with cancer. And both of those breaks have been very negative for me because my cancer spread to other parts of my body during those times in really rapid succession. So during the long haul of treatment, you may or may not experience hair loss. Your eyebrows may fall out, your eyelashes may fall out, your pubic hair may fall out. Chances are it will fall out. Hair is not what makes you male or female. It's nice to have. There are so many different things that you can do to help yourself at that time. There is microblading, which is a temporary tattoo. It only lasts for several years, like 2 to 3 years, that you can have to apply eyebrows. You can also buy theater eyebrows, which stay on for up to 3 months, and you can make them look the way that you want. If your hair thins, like my hair is quite thin, you can do hair extensions, or you can wear wigs, or you can do what a lot of women that I know have decided to do and just go natural. If you lose your eyelashes, you can use fake eyelashes, but be very careful because the glue can sometimes cause an allergic reaction, and also everything is being messed with by the chemo, so your skin may be quite sensitive to the glue. If you have little stubs, you can get eyelash extensions. Those are glued to your eyelashes and they last for like I think 6 weeks. Every 6 weeks you go in and you get them filled in. So there are things that you can do. Of course, they're expensive and insurance doesn't cover those things, but they're options. There will be lots of mile markers, and sometimes you might feel sad at birthdays, holidays, or events, because those sort of things tend to bring out in people the emotion that how many more birthdays will I be part of? How many more Christmases will I be part of? But I guarantee you, I promise you, you will reach a point where I guarantee you will look back and you will say, wow, it has been X amount of Christmases, birthdays, holidays, whatever. I used to tell my kids when they were really little and they were very excited to do something, like school was going to start or Christmas was coming, I would tell them it's 3 more sleeps till Christmas comes, and they'd be really excited to go to bed at night because they knew that when they'd wake up the next day it'd be 2 more sleeps and then 1 more sleep. I look back now on my life and I say it has been, 5 Christmases, 5 New Year's, 15 birthdays, because there's 3 members of my family aside from myself. I've received a dog, I've traveled, I've moved, I've blogged, I've met some of you people who are out there either by communicating with you online or met you personally, and you will reach a point where you're not looking forward anymore, but you're looking back because you have built memories, and even if they're slightly tainted with a little sadness because you wonder how many more you have, I guarantee you, you will be able to look back and say, I had this birthday, I had this Christmas, I had this trip, and sorry, I have allergies. And that is the wonder of living in this time. You do get to live with cancer. So I think that pretty much covers everything that I had written down that I wanted to talk to you about. You can live with metastatic breast cancer. You might not always feel great, but feelings are fleeting, and you may not always think the best of yourself, but there are things you can do to make yourself feel better, happier, living in the moment. And I recommend that you surround yourself with positive people, and I recommend that you enjoy this time if you've just been diagnosed, of people surrounding you at your treatments, and count the blessings of learning who your true friends really are. It has been really nice sharing my journey with you, and I continue to do that next week with talking about planning for your end of life. And it's a positive thing because you are going to get a lot of years, but being prepared for that end, knowing what it is that you want and being able to verbalize it to your family. For instance, I know I don't want to be at home when I have my final days. I want to be in a hospital with people who know how to take care of me. That is what I mean by end of life planning. Make sure the people you know and love know what you want for that time. And even the people who are healthy in your life, you should be talking about what they want in their end of life planning. So at any rate, thank you so much for stopping by my channel. Please hit that thumbs up. Take a moment to like, follow, or subscribe. And if you think this video in any way could help somebody else, please share it with them. And I'm sorry for the rambly format of this video, but I just truly wanted everything that I said to you today to let you know that this is something that you can live with. You can live with cancer. You can live a great life. You can live great memories and moments, and just get out there and grab life by the balls. Here's a hug from me to you, and thank you so much for stopping by. Consider yourself hugged. Bye.